I'd like to go over this interesting case where vision blue migrated posteriorly, staining the posterior capsule and the anterior vitreous. And you can see that I've lost my red reflex. In this process here, I'm just about to put the lens in. You can see how difficult it is because you've lost all your landmarks. So the lens is going in right now. This is the lens here. You can see just how difficult it is to see the landmarks of the capsular bag. And here I'm just going to gently nudge the lens posteriorly. But again, you can see how staining of the posterior capsule can make the subsequent steps of the surgery more difficult. So here's the lens. Now, this is what I typically do if I run into this situation, and I'm just not sure, is the lens entirely in the bag? I have the patient look in different fields of gaze because often that will highlight the red reflex. And you're going to see that here. So you're going to see that the bright red aspect of the red reflex as the patient looks in different quadrants. And that allowed me to confirm the lens was in fact in the capsular bag. So I'm just going to watch that again. You can see that the lens actually lights up a little bit because I'm having the patient look in regions where there isn't staining of the capsular bag. So this is the end of the case, and the patient otherwise did well. But my other take-home point for you is, let's go back to the first video here. So this is the video where I'm putting the lens in. So my other tip is, if you're in the situation and you're just not sure whether the landmarks are adequate for you, or you're concerned that because you can't see well, that you're concerned the lens might hit the capsular bag, well, you don't have to put the lens in. This goes back to what I was saying about one of my other videos about leaving the patient aphakic. What you can do if you're in this scenario and you're in the process of putting the lens in is don't put the lens in. Don't even load the lens. Leave the patient aphakic. Bring the patient back in a few days. The trypan blue would have been gone by then, and then putting the lens will be so much easier. So that's my take-home point for this case, is the vision blue can migrate posteriorly, and if it does, it can make subsequent steps of the surgery more difficult. I'm highlighting here the difficulty with lens delivery. In terms of prevention, obviously this happens when we come across areas of loose zonules where the trypan blue can migrate posteriorly. There are ways to prevent it, but even in the best methods, this can still happen. It can happen in routine cases as well. So what are some tips to potentially avoid it? Well, use enough vision blue to stain the capsule, but not too much that it might migrate posteriorly. If you use viscoelastic at first and then put the trypan blue to basically brush under the viscoelastic, that may be another option. If you have an area at the beginning of surgery where there's clearly a deficiency in like a quadrant of absent zonules or weak zonules, you can put dispersive viscoelastic in that region before you put the trypan blue. Otherwise, it will migrate posteriorly. I hope you found this case to be useful, and thanks for watching.